አንዱለት እንደምን አደራችሁ ያውኑ ይሻላል ክብራትና ክብራን እንግዶቻችን በቅድሚያ ጥሪያችንን አክብራችሁ ስለተገኛችሁ እናመሰግናለን አሁን ፕሮግራማችንን እንጀምራለን Good morning ladies and gentlemen on behalf of the Ethiopian Public Health Institute the Ministry of Health and WHO Ethiopia it is our great pleasure to warmly welcome you all to the official launching ceremony of the Public Health Emergency Management PHEM Center of Excellence. We are deeply honored by the presence of our distinguished guests from respective ministers, line agencies, regional health bureaus and public health institutions, members of the diplomatic community implementing and financing partners, esteemed colleagues and all stakeholders in public health. Thank you for joining us to witness this significant milestone event, Ethiopia's public health emergency preparedness and response journey. To officially welcome us and brief us on today's event, I now have the distinct honor of inviting His Excellency Dr. Melkamu Abate, Deputy Director General of the Ethiopian Public Health Institute, to come to the podium. Kindly join me in welcoming him. Your Excellency, please.
Good morning. Excellencies, Dr. Daraje Daguma, State Minister, Minister of Health, Dr. Masai Hailu, Director General, Ethiopian Public Health Institute, Regional Health Bureau Heads, and Public Health Institute Directors, Dr. On Kalwa, WHO Country Representative, Dr. Wasson, Africa CDC, Emergency and Preparedness and Response Aid, representatives of respective ministries and line agencies, Minister of Health and EPHI management members, members of the diplomatic community, and representatives of respective partner organizations, colleagues, distinguished guests, ladies and gentlemen. Good morning and welcome to this launching event for the Public Health Emergency Management Center of Excellence initiative. Since 2009, our national public health emergency management within the Ethiopian Public Health Institute has been the cornerstone of our response to public health emergencies, ensuring coordination and preparedness at every level in the country. In this regard, we continue to prioritize building a robust public health emergency management system to enhance resilience against emerging health threats. As we have completed our first multi-year national action plan for health security in 2023 and embark on the second NAPS, we reaffirm our commitment to further improving our health security capabilities. The first joint external evaluation and the second, which has been done earlier this year, drive us to continuously refine our emergency health management systems, recognizing the need for defined legal and strategic framework, a dedicated emergency funding source, improved governance, strengthened international coordination and solidarity. It is in line with this that we have developed this strategy for Public Health Emergency Management Center of Excellence initiative, with the aim of strengthening the core functions of the public health emergency management, enhancing institutional capabilities, and elevating the country's ability to manage public health crises. This initiative aspires to integrate structured improvements in digital health information systems, robust workforce development, and efficient emergency response coordination. Having consolidated the strategy, we are here today to present it and begin diligently advocating for its successful implementation. This initiative is built upon a number of global and national frameworks, namely WHO's disaster risk management framework, and Africa CDC's strategic initiatives, Ministry of Health Sector Transformation Plan, EPHI's 5-year strategic plan, the PHEM guidelines to have all its core functions. From there, we have developed a conceptual framework around 5 strategic focus areas, which in turn translate into respective strategic outcomes, objectives, and initiatives. As we embark on the implementation of this significant strategic plan, we understand that it shall be a task which will test our competence and resolve. However, considering the significant milestones we have crossed to get here, our phases, this is truly possible, and it is achievable. That by galvanizing our efforts and laying a solid foundation for public health emergency management, which ensures adequate preparedness and response capacity and capability, we can realize the goals that before us. And through these undertakings, furthermore complement the overall health system strengthening efforts underway nationwide that is done through the Ministry of Health. In conclusion, efforts directed toward safeguarding public health security require strategizing, collaborating, and executing on multiple levels. The PHEM Center of Excellence initiative framework is one which allows for fostering and utilization of linkages on compound level, with through robust interactions, underlying efficiency and delivering impact are what will ensuring to the visibility of this change. Thank you all for joining us today. Thanks so much.
We thank His Excellency Dr. Melkamo for the welcoming speech. Following to delivering his message via video, as he was unable to be here in person today, we have His Excellency Dr. Chikwa Hekwaz, Acting Regional Director for WHO Afro Region, delivering a keynote remark on behalf of the WHO.
Your Excellencies, distinguished guests and partners, colleagues and friends. Your Excellencies, distinguished guests and partners, colleagues and friends. Warm greetings from the World Health Organization, Regional Office for Africa. Honorable Minister, my dear sister, Dr. Mekdes Daba, I regret that I cannot be with you in person today to celebrate this milestone, which I discussed with you just a few weeks ago. I'm truly honored to address you virtually at the official launch of Ethiopia's Center for Excellence for Public Health and Emergency Management. This is a landmark achievement for the Ethiopian Public Health Institute, for Ethiopia, and for our dear continent. For over a century, EPHI has led with distinction, strengthening surveillance, responding to outbreaks, and building the skilled workforce we need to protect African lives. This new Center for Excellence is a bold next step. It reflects Ethiopia's commitment to lead in emergency preparedness through science-based action, innovation, and collaboration. The threats we face are growing more complex. These include climate shocks, pandemics, and conflict. But this center sends a clear message. Africa is rising to the challenge with clarity, competence, and collaboration. WHO is proud to work alongside Ethiopia on this journey. We look forward to working together to strengthen core capacities under the international health regulations, to grow our regional expertise, and to ensure that no emergency finds us unprepared. Let us build a safer, more resilient Africa that is ready to both respond and to lead. Thank you.
Thank His Excellency WHO Regional Director for Africa. We are truly grateful for your inspiring words and continued support to public health emergency management across the continent. Once again, thank you. Now, with great honor and respect, I will call upon His Excellency Dr. Wesson Mankola, Africa CDC Emergency Preparedness and Response, here to the podium to deliver his keynote address. Your Excellency, please.
Good morning, everybody. Dr. Dirij Dogma, State Ministers, Minister of Health of Ethiopia, Dr. Masai Hailo, Director General of EPHI, Dr. Owen Kalua, WHO Representative, all protocol observed. It's really a pleasure to be here today to celebrate launching the Public Health Emergency Management Center of Excellence of Ethiopia. As you know, for 2024, last year, we reported in the continent more than 200 public health emergencies happening in 1 year. On a weekly basis, we in Africa CDC reporting between 3 to 4 public health emergencies happening. And to address those public health challenges that are happening in the continent and happening in most of our African countries, Public Health Emergency Operation Center coming as a cornerstone for managing information and managing resources to ensure efficient and quick response to various public health emergencies. In this regard, back to 2018, Africa CDC, in collaboration with WHO, UCDC, UK Health Security Agency, European CDC, Robert Koch Institute, Resolve to Save Lives, we launched an initiative to put all our effort together to strengthen Public Health Emergency Operation Center in the continent. And one of the key outcomes for this collaboration, launching our strategy for strengthening Public Health Emergency Operation Center in Africa. And we did a lot of effort to push this agenda forward. And we're really happy to see the progress happening here in Ethiopia. We're really proud of the experience of EPHI and Ministry of Health of establishing the Emergency Operation Center here in Ethiopia. We're looking for this as one of the key models for Public Health Emergency Operation Center in the continent. And while we in Africa CDC launched the Public Health Emergency Management Fellowship to support having cadre of Public Health Emergency Operation Center in the continent, we're looking this year in our cohort to put in their program having experience sharing through visiting Emergency Operation Center in EPHI and having sometimes to learn from their experience in establishing Emergency Operation Center. We're providing this to our fellows to see one of the success models that we have here in the continent. And also for us in Africa CDC, last year in collaboration with African Development Bank, we wanted to boost the Emergency Operation Center capacity in the continent. So we had an initiative to support 23 member states in terms of the infrastructure for the Public Health Emergency Operation Center. Actually, the Public Health Emergency Operation Center in Ethiopia are among those centers will be providing equipment that worth around $500,000. It's already delivered to the countries. We'll be starting soon the innovation and installation for those equipment to have a state-of-the-art facility for the Public Health Emergency Operation Center in Ethiopia. And we hope with this kind of support, with improving the infrastructure for the AUC, will be helping to operationalize and activate the PHEM Center of Excellence in the coming period. And while this Center of Excellence coming to boost the capacity building in the country and strengthen those capacities in the country, but we are looking for collaboration with Ethiopia to have even this Center of Excellence not only for Ethiopia, but also for East Africa region and use this to support other neighboring countries. Congratulations again for Ethiopia for this progress, and you have our commitment on behalf of Africa CDC Director General that will continue providing the necessary support and continue working with WHO and other partners to make sure that we have a proper Center of Excellence for Public Health Emergency Operation Center in Ethiopia. I thank you.
We thank Dr. Wilson for the keynote speech. Now I will call upon, with great respect and honor, His Excellency Dr. Masai Hailu, Ethiopian Public Health Institute Director General, to give us a keynote address. Your Excellency, please.
እንደምን አደራችሁ። Your Excellency Dr. Daraja Duguma, the State Minister for the Federal Democratic Republic of Ethiopia, Minister of Health. Your Excellency Dr. Aun Kalua, WHO Country Representative for Ethiopia. Dear Dr. Melkam Abite, Deputy Director General for Ethiopian Public Health Institute. Your Excellency Brigadier General Dr. Hailu Ndeshaw, the Delegate for National Defense Health Main Department. Excellencies, ambassadors and diplomatic community, dear Dr. Wasen Makwala, Head of the Emergency Preparedness and Response at Africa CDC, the representatives of partner organizations, colleagues, distinguished guests, ladies and gentlemen, good morning. I'm honored to welcome you all today to this launching event for the Ethiopian Public Health Institute, Public Health Emergency Management Center of Excellence Initiative. At the Ethiopian Public Health Institute, one of the oldest national public health institutes in Africa, today I express our continued commitment to enhancing our capacity of safeguarding the public health needs of our people. Since being granted its specific duties and mandates by the Council of Ministers in 2023, the Ethiopian Public Health Institute has been and continues to be primarily responsible for leading and coordinating public health emergency management, capacity building of the national laboratory systems, and research on priority public health and nutrition problems in the country, as well as carrying out health and health-related data management and analytics for evidence-based scientific decision-making, and coordinating the National One Health and International Health Regulation Coordination Office at Ethiopian Public Health Institute. In this regard, we have also recently performed restructuring to further refine our workflow, build on our efficiencies, and enhance our partnership modalities to ensure far-reaching impact. The Public Health Emergency Management Wing of the Ethiopian Public Health Institute has done remarkable work in identifying risks, activating contingency plans, running effective and well-coordinated response through emergency operation centers, both nationally and sub-nationally, positioning and disseminating logistics, and providing vaccination campaign response to multiple public health threats in collaboration and leadership of the Minister of Health. The Institute has been activating the public health emergency operation centers to investigate, prevent, detect, and control various outbreaks attributable to man-made and natural disasters, health threats including COVID-19, cholera, Ebola. Actually, it's not happened in Ethiopia, but coordinating and preparedness and prevention of this kind of health problems of international and continental concern, dengue, measles, polio, malaria, and conflict-related risks. This Center of Excellence initiative therefore seeks to set us on trajectory towards realizing the mission we have set before us to advance Ethiopia's public health emergency preparedness and response capabilities and capacities to strengthen health systems that will ensure health security of Ethiopians and beyond. This is truly a mission of great importance, indicating that here is a great deal of work ahead of us. On this occasion, I would like to stress that the strong collaboration of our partners around the focus areas set before us will be essential to the successful implementation of the initiatives to realize the set goals. We are confident to bring this before you today, considering the long-standing commitment we have witnessed across the board over the years as we all tirelessly work to grant effective emergency response endeavors. In closing, I would like to express my sincere appreciation to the World Health Organization team for their long-standing partnership and steadfast support to the Director General of the ECHO, Jordi, and to all colleagues, partners, and friends of the Ethiopian Public Health Institute here today. Thank you for making the time to join us this morning, and to all the organizers of this event. I extend my heartfelt gratitude to all of them. Thank you again for joining us, and look forward to deliberations and insightful exchange. Thank you very much.
We thank His Excellency Dr. Masai for the keynote address. Now, to officially open today's program, it is my honor and great pleasure to invite His Excellency Dr. Daraja Duguma, the Federal Democratic Republic of Ethiopia, State Minister of Health, to deliver the official opening address. Your Excellency, please.
Good morning, everyone. Dr. Masai Hailu, EPHI Director General, Dr. Malkamu Abite, EPHI Deputy Director General, Dr. Owen Kalwa, WHO Country Representative to Ethiopia, Dr. Wasan, representing Africa CDC, Regional Health Bureau Heads, PHEM Directors, delegates from the different ministries and the commissions in Ethiopia, delegates of our partners who are here with us, who have been supporting Ethiopia over the last many years around public health management. Ladies and gentlemen, good morning once again. I'm so much pleased today to stand before you on this special occasion of launching PHEM Center of Excellence, and I would like to welcome you all on behalf of myself and Ministry of Health to this important platform where we launch and also where we discuss actions forward and how to strengthen the PHEM response at all levels. As has been said by previous speakers, this PHEM Center of Excellence initiative will enhance the core capacity of public health emergency management and response. I mean, the 4 capacities that include 1, early warning and detection, which is an important issue in the PHEM response mechanism. And the second one will be the rapid response to public health emergency crisis. And the third one will be effective recovery in a timely manner and in an effective way. And also mitigation of public health emergency crisis. And these 4 important core capacity of public health management system will be enhanced through this important initiative that will enhance our capacity at national level and also at regional or continental level, as the acting DG has been saying on. As you know, ladies and gentlemen, the government of Ethiopia has gave due attention for public health emergencies, and Ministry of Health with its technical arm EPHI, we're working on strengthening the capacity of public health emergency management. And that's why we have structured EPHI in a very unique way, where 3 pillars of public health emergency issues has been deliberated together. The first one is the PHEM part, as you know. And the second one is the lab part, which is very important for public health management response. And also equally important is the research. It's also very important, and we're able to bring these 3 important pillars together. And as you know, many African brothers came here to see the experience we have on the ground, especially around the systems that we have established at Public Health Institute. And actually, I'm so much honored to have regional health bureaus who really owned this initiative, and now in some of the regions we have standalone public health institution, but even in other regions it has been one of the areas where regional health bureaus and regional governments have gave refocus. That's why Ethiopia has adequate responders to COVID-19 emergencies and also many other outbreaks that happened in the country. We have also worked on strengthening the health workforce of public emergency in general, and the logistics and infrastructure part has been well invested on. As you know, We have many regional laboratories, and also recently we'll start to construct a new national reference laboratory, which will also enhance the capacity of Ethiopia in terms of responding to emergencies. Ladies and gentlemen, and the different diplomatic community who are here today with us and also our partners, as we all know, our globe is passing through many challenges, especially multiple layers of crisis are happening in the world right now while we are speaking. Climate change is an important challenge that happens to all of us. Conflict in different parts of the globe is a reality. Outbreaks, especially the different health outbreaks that have been seen in the continent, as Dr. Wassans from Africa CDC rightly mentioned, and contamination of water bodies, and of course hazardous chemicals, radiation, and toxins are threats for our community and also for the future generation. The list will continue, as you know. And this initiative of PHEM Center of Excellence in Ethiopia will aim to tackle the challenges that I've already mentioned in Ethiopia and actually in the continent. And actually it came into an effect at the required and critical time. We all know that international and foreign financial aids are decreasing. And at this challenging time, we need to see how we can really finance our own public health emergency response through our own capacity and through our own funds and resources. And I think that's why we are gathered here. This important initiative will also bring resources from the different partners and the international community so that member countries, Ethiopia and other countries in Africa, which are hugely affected by the many outbreaks that we see every day, will finance their own problems by their own capacity. And I'm sure we are all here for this noble cause. We know that Ethiopia is expanding its economy and a global connection through the diverse trade and diplomatic relations that we have many countries. And Ethiopia is also boosting its economy, as you know. Recently, through the report of IMF and World Bank, as you know, Ethiopia has one of the fastest ever increasing economy in the continent, in the soil of African continent, and also beyond. And our leadership, including His Excellency Prime Minister, has worked a lot in improving the economy of the country. And also we have a robust bilateral and multilateral relations with different organizations and member countries, as you know. And actually, millions of people travel to and from Ethiopia through the different connections that we have, also through the Ethiopian Airlines. We have a robust connection with many countries. And especially in the East Africa, we are strategically located, and the borders that we have with our neighboring countries are really porous, as you know. And actually, the member countries, which are our neighbors, have also a weaker public health emergency management. That's why Ethiopia needs strengthened capacity in PHEM response. And as you know, Ethiopia, Addis Ababa, our city, is the seat for Africa Union and many international organizations next to New York and Geneva. So this requires a very strong and robust public health emergency management in Ethiopia, and I fully believe that having a strong public health management in Ethiopia, having strong public health management in the continent. And actually, Africa CDC has also is supporting this important activity in our country. As we celebrate EPHI as one of the oldest national public health institution in the continent, we are about to celebrate the 100th year anniversary of this noble institution. This is an opportunity time to launch this PHEM Center of Excellence initiative in our country. We believe that this initiative will scale up our PHEM capacity to a new height in Ethiopia and also beyond. And this huge undertaking requires resources and technical support from our partners, from Africa CDC, from the international diplomatic member community which are here with us today. In the context of the current diminishing foreign aid, as I've said, PHEM support have to be seriously considered going forward. And actually this initiative will also bring more capacity to tackle the challenges that have been mentioned before. This gathering, in this gatherings, I can see governmental organizations, non-governmental organizations, members of the diplomatic community, and our partners who have been supporting the public health emergency management system in Ethiopia over the last many years. I would like to thank you for your continuous dedication in supporting us in tackling the different challenges, especially the public health emergency challenges that we have been passing through. Especially, I know the support of our international community and partners during the fight against COVID-19, and also recently on malaria and other outbreaks in Ethiopia and also in the continent. But going forward, we need to mobilize more resources and to bring more technical capacity to Ethiopia so that we'll build our system together and we are able to tackle different outbreaks in the continent. In conclusion, we can do more together. And being united in the continent, we can fight these outbreaks and we'll have more resilient Africa, more healthier African and also Ethiopian, and it will also improve the livelihood of our community going forward. The proverb of Ethiopian says, I mean, united we can bring a sustainable change in the continent and also in Ethiopia, and we can contribute for the global health security at continental and also at national level. And for this noble cause, we need a serious coordination and collaboration, and this is very important for us. Our partners, international communities, government offices at regional level, at district level, and also at national level, we need to coordinate and collaborate more on this important issue. And now I declare that this official meeting on this launch event on PHEM Excellence Center in EPHI is officially open. And thank you very much. Have a fruitful deliberations. Thank you.
We thank His Excellency Dr. Dereje Duguma for your strong leadership and support in advancing Ethiopia's public health preparedness. Your Excellency, thank you very much. ክቡራትና ክቡራን እንግዶቻችን ክቡር ሚኒስትር ሌላ ኮሚትመንት ስላለባቸው እሳቸውን በክብር እንሸኝና ቀጣዩን ፕሮግራማችንን እናከናውናለን ማለት ነው። We now invite back to the podium His Excellency Dr. Melkamu Abate, Deputy Director General of the Ethiopian Public Health Institute. Dr. Melkamu will walk us through the journey of EPHI's Public Health Emergency Management PHEM program, providing insights into the key milestones to date and introducing the bold flagship program, which is the PHEM Center of Excellence Initiative. Without further ado, Your Excellency, the floor is yours.
Good morning again. I'll be brief on this because it has been mentioned by all of the speakers before, and I know that you wanted to have a coffee break as well. So I'll be very brief on this. So I'm just going to say about the road to Center of Excellence in PHEM. And the road to be a collaborating center, be it regional and be it a global one. This is the historical context of EPHI. As it has been mentioned earlier by Dr. Masai and His Excellency Dr. Dereje, Ethiopian Public Health Institute is one of the oldest and the strongest Public Health Institute in Africa. We are not just counting the years. We are now celebrating the achievements that we made so far. So it is not a matter of years. We are speaking on the achievements. We are reflecting on what has happened to EPHI. So we go through different names, which has been started in 1924, and then proceeded with so many names. Then at the end, in 2013, Ethiopian Public Health Institute, the name Ethiopian Public Health Institute has established, and having the different mandates that we have. So we'll celebrate this in a longly awaited ceremony that is going to happen soon. But the point here is that going through this 100 years, we do have so many experiences, be it in leadership, be it in emergency management, in research, in laboratory. So this can be one of the foundation to be a center of excellence. This is the things that we are talking about, this EPHI's journey. As next to the EPHI's journey, we need to talk about this, the PHEM evolution, how PHEM is evolved in the country. As you all know, in pre-1980s, our surveillance system has used this vertical surveillance program. And then 1996, we have introduced this IDSR. And then we have adopted this AFROS IDSR strategy in 1998. And then after, PHEM is evolved in the country in 2009. That is by the new BPR system, which was made a decade back. That is a turning point for public health emergency management evolution. As most of us remember, the evolution of, I can say the transformation of the Ethiopian health system is the introduction of health extension program, which was in 2003. That is usually said to be the turning point for Ethiopian health system. As to the Ethiopian PHEM system, 2009 is said to be the turning point. And now the second is going to be this 2025. We are deciding, we are committing to be a center of excellence for public health emergency management. So this is going to be a second turning point for public health emergency management. So this is a vision of EPHI. This is to be a center of excellence in public health in Africa. This is the vision of EPHI and the mission as that is stated there. The thing here is, to be a center of excellence is the mission of EPHI and the vision of EPHI. As part of that, we are now working on to be a center of excellence in public health emergency management. The thing here is, it is part of EPHI's mission to be a center of excellence. And the strategic objectives and the mandates that we have is, we are managing the public health protection and emergency response, resilient laboratory systems and services, evidence-based innovation and evaluation, and finally, you all know that we have the data and analytics National Data Management Center is at EPHI. This is to show you the organizational structures, which is emanating from our mandate. Under the DG, we have 3 DGs with the main mandate that we have given. So to make it separate one as to the PHEM structure, under the Director General, the PHEM is organized to have the preparedness directorate. This is after COVID that we have learned it. Working on preparedness really matters. That is why when EPHI is restructured, this structure is going at the front. And then the surveillance and the warning directorate, response and recovery directorate, and as it has been stated by His Excellency Dr. Daraja in the opening remarks, we have this Travel and Border Health Directorate. As we are hub for Africa, and we are bordering with so many countries, so that this travel and border health is one of the things. So the role is within the 4 directorates. You all know that. I will not go through all those things, but this has been touched by the opening remarks from the speakers before. So I will not go through all this. As we are going through the activities that we have, we are aligning all the documents with the global and regional strategies and frameworks, with WHO, Africa CDC, and others, and as well with the country aspects as well, national policies and strategies. So the national documents that we are using is the disaster risk reduction policy, which is mainly done by the ADRMC, and the health policy, which is currently revised, and which included most of the issues that we are talking about. And the main shift that is considered here is that it concentrated on this public health emergency resilience system creation. And also, our health system is shifted not only on the prevention, but also on the curative aspect. We have this, the strategic plan and the ministry and that of EPHI strategic plan. When we go through all those things, what were the key achievements and the lasting impacts that we have made? I'll go through on some of them. So, as part of, as one of the cornerstones for this initiative is developing on the workforce. So for this, you all remember that globally, there is Global Health Emergency Corpus. But in Ethiopia, we have started this Ethiopian Health Emergency Corpus, the EHEC, which included the RRT, the AMT, the FTP, and that of the AVOC surge. So we have this 809 field epidemiology training programs, trained people, and that of the frontline and the intermediate one. So this is the workforce. As you can see in the image, and then the initial slide, our workforce down on the ground, they are moving in far-to-reach areas, while addressing the vaccination for those people who are not vaccinated. This is the AVOC surge, the AVOC surge training. We made the 3rd round, and now we have this 304 AVOC surge trained health professional. This is multi-sectoral, and this is going to be deployed anywhere in Africa. And we are able to make this 304 health professionals. This is one of the bigger milestones that we have made on the workforce development. The other thing is the AMT. You know that we have deployed these AMT teams in the different disasters in the country and the different mass gatherings that we have. That is when in African Union, and in the devastating issue of this Gofa landslide, we have also deployed the AMT there. And the other thing is this National Public Health Emergency Operations Center. This is a center which is going to coordinate the activities and the responses at the same time. So every activity should come to to the Emergency Operations Center for coordination. So we have, as it has been mentioned earlier by the speakers, Dr. Wasam from Africa CDC and WHO, there are people coming from different countries to visit our emergency operations centers. These are the images which shows it. We were having this Global Public Health Emergency Operations Center simulation exercise, which is done for the second time and the first time in Africa. We had it like 4 or 5 months back in the presence of different health professionals around the world. And this is graced by Her Excellency Dr. Mekdes Daba, Dr. Masai, and WHO people from headquarters and the Afro and that of the country office. This is coordinated by WHO. We really appreciate that. This was a very nice experience. This is the FEOC expansion, the public health emergency centers in the country. We have expanded not only at the national level, but also down to the regions. And some of regions do have also this sub-regional emergency operation centers. And in the future, one of the flagship initiatives that we have is expanding these emergency operation centers down on the ground. This will allow us the activities and the responses to be coordinated near to the population down there. So this will be one of the things that we need to support, and we are committed to make it to happen. So when we have this emergency operations center, this shows the leadership, the top ministerial leadership is at the emergency operations center, leading the IMAs. So all the regions regional health bureau heads were part of this, and this shows that leadership is in action. And how we are using and we are implementing this emergency operations center for the different emergencies that are facing the country. And also we are working with the different sectors, with the defense, with the federal police, and with other stakeholders, including the RMC. As we have stated, one of the things which is needed is having multi-sectoral collaboration. This is mentioned earlier. The world is more connected than ever. So our travel and border directorates, we are working 24 hours and 7 days at our point of interest, be it in air crossing or ground crossing areas. So we are giving this service 24/7. And we have prepared this electronic traveler's health declaration form to know the risk, and so we have dedicated ourselves to work with these crossing areas anywhere. And also this is the travel sites and the sites for this Bole International Airport and the airlines. So the communication is so high. That's why we are diligent on this traveling border activities. So now, why we have this Center of Excellence initiative? The one thing that I mentioned earlier is the strong public health leadership. Ethiopia has a long history of safeguarding public health, with EPHI as one of Africa's oldest national public health institutes. We have this 100 years of experience in leadership. The regional director, Afro regional director, was having a visit to EPHI with his team. One of the delegates, that is the emergency preparedness regional director, is saying that we know that you have 100 years of experience. You are very nice in responding and controlling emergencies. Why you are not Center of Excellence center till now? This was his question. So we have a proven capacity and performance, which is done by WHO and Africa CDC, and also the strategic importance of our location, which is mainly related with our airlines. If you remember, during COVID, one of the fantastic jobs done by specifically on the logistics aspect is by Ethiopian Airlines. So this will make us one of the areas to aspire to be center of excellence. And our contribution toward this global initiatives, be it WHO, Africa CDC, and others, this will reinforce our idea of to be center of excellence. And we are now making our service to be a collaborating center, be it regional and global, with WHO, Africa CDC, and others. So we have started this journey, and the application is started with WHO. So this is going to be elaborated much deep diving with the panel discussions that we are going to have. So this is the strategic focus areas that we are going to deal with this center of excellence. One is we'll work on governance and leadership. This really matters. Unless we lead, we can't make it what we need. So this leadership includes the policy, the procedure, and to invest on the workforce as well. So the next is we need to work on the workforce capabilities through learning and innovation. And then the information technology and evidence-driven learnings. This is one of the areas that we need to invest. So this will make things easy, and our surveillance will be as sensitive as possible. And innovative and sustainable financing will be the other one, and the last one is we need to enhance on these logistical capabilities. When we have emergencies, when we get different emergencies, we need to have finance, and the other thing is we need to have a system to make down on the ground. This is the goal. The goal is as it is written. But on the edge, there is a strategy. That strategy is we are planning to be center of excellence in 3 years, starting from 2025, and then till that of 2027. This is a 3 years program. The vision and the mission. This is from EPHI's vision and mission. And with the motto of excellence in health security, strengthening resilience, and the outcome of having a resilience is to save lives. This is our motto to be center of excellence. And as to the current progress, as I mentioned, we have made a strategic plan, which is 3 years strategic plan to have this center of excellence to be achieved. And then we have identified stakeholders, and there is a stakeholder engagement plan. We have prepared this stakeholder engagement plan. To be center of excellence, the other thing which need is a resource, and we have this resource mobilization plan. So these all are prepared. The center of excellence, this needs different levels of engagement. The function has to be multifunctional. It has to work with the different sectors, multi-sectoral and multi-level. It has to start with down on the ground, with Warada zones, regions, and that of national level and international. So we'll work on at every level. This is a costing. As I've stated earlier, we made resource mobilization and the costing, resource mobilization plan and the costing. So this is the total cost to be a center of excellence. in the different players that we have assigned. So the other thing is to be collaborating center. For this, as I mentioned, with WHO and Africa CDC and others, we are working closely. And we have shared insights on strengthening public health emergency operations center for the different African countries, and having the operational capacity for Kenya, South Sudan, Malawi, Zimbabwe, and other African countries. And also we made a global conducting regional and global EOC simulation exercises and other simulation exercises. And we have deployed so many experts when there is an outbreak in Africa, and we have deployed our health professionals there. And we provide laboratory testing for member states. So this will make us a collaborating center for WHO and for others as well. And to zoom in, the flagship initiatives that we have, and that really matters. So when we dissect it, one of the things that we are working is on risk profile. Every warada, every district needs to know its risk at some national level. And the other thing is we are now on the way to finalize this community PHEM program, which started from the community with health extension workers, integrating this ECHS with the surveillance system, the volunteers. So this will be one of the flagship initiatives that we are going to launch in the near future. And the workforce development, this EHEC, PHEM health facility, and the collaborative surveillance and effective response is one of the initiatives that is started. Everything, every hazard has to come, and the surveillance system has to be collaborative. The other is on the digitization. We are now on the verge of finishing the HIS2 implementation to the regions. So as to yesterday's report, there is about we have trained about 80% of the officers in all the areas of the country. So we are going to implement this DHIS2. This will improve our data system, our data quality mainly. And for the event-based surveillance, we are now implementing this AIOS. This is a WHO platform. And for the operational aspects now, we are implementing this electronic PHEM. This electronic PHEM is a new one which is going to improve our operations, which starting from the signal to that of response. So we start from the community with the initiatives that we have till that of the national level, and we arrange the feedback system in the reverse way as well. So by this all initiatives, we are going to address all the structures that we have in the system. As a call for action, this is stated earlier, but one is this multi-sectoral engagement. There are different sectors which needs to be engaged in this Center of Excellence initiatives. And what we need from you is a strategic partnership. This is a strategic initiative, and we need your partnership. And this is a collaborative effort. So as we establish the Center of Excellence, this is a hub. This is a platform. This is just a platform. So that every activity needs to come at the same time. So that's going to be coordinated at the same time, and the response has to be in a coordinated way. So this will allow for our vision, one plan, one budget, and one report. So this is going to be a platform to efficiently use our resources as well. Thank you so much for your listening.
thank you, Your Excellency, for such in-depth and powerful presentation. Prior to transitioning into the next half of this event, why don't we take some networking and mingling over the by the refreshment section, and we will convene back here for the second half of the event. Once again, thank you all. ሻይ ቡና ካልን በኋላ 20 ደቂቃ ነው ያለን። ከ20 ደቂቃ በኋላ እንመለሳለን። we will be back here after 20 minutes. Thank you all.
ሲኒጋር አንድ ኮፊ ቴብል ይፈልጋል።
ፕሮግራማችንን ሊጀምር ስለሆነ ከአዳራሹ ውጪ ያላችሁ ወደ ውስጥ እንድትገቡ፣ ውስጥም ያላችሁ ደግሞ መቀመጫችሁን እንድትይዙ በታላቅ አክብሮትና ትህትና እንጠይቃችኋለን። Now we will start our program. Kindly be seated. Welcome back. Hoping you all have a pleasant refreshment session and were able to network while you were at it. For their continued support and collaboration, we thank our esteemed stakeholders and partners, government organizations including respective ministries, line agencies, regional health bureaus, public health institutions, UN agencies, multilateral agencies, donors and implementing partners, and respective diplomatic missions. We thank you all for your attendance and look forward to your continued collaboration. Now the second half of the event begins with a panel discussion to be moderated by His Excellency Dr. Malkamo Kabate. I therefore welcome him to the podium to invite the respective panelists and carry on the much anticipated conversation.
Good morning again. Thank you so much. So, I will call upon the panelists for this very critical initiative that we are going to launch. So the CV is so long, so that I will not mention, I will not go through all this, all the long CV. The first is start working, have worked as a vice president for Hawassa University, and now he's our director general at Ethiopian Public Health Institute. Please let Dr. Masai to join as a panelist. Thank you. Thank you, Dr. Masai. And our next panelist is before his appointment as representative to WHO Ethiopia, he served as a country representative for South Africa, country representative for Ghana, and representative for Eswatini. He is currently our WHO country representative for Ethiopia. I kindly request you all to invite Dr. Kaloa on to the podium. Thank you. In most of our initiatives, World Bank is at the back. So I'll invite Dr. Sherin. He's a medical doctor and has specialized in public health sciences, including health sector policy and health economics. He's a World Bank program leader for development, for human development to Ethiopia, South Sudan, Sudan and Eritrea. He has over 22 years of experience in developing programming and humanitarian leadership. So I'll invite Dr. Sherin to the podium. Including this initiative and others, we appreciate the support from ECHO. So I'll invite Jordi, he's the focal person in the DG for ECHO country office for health and nutrition sectors, as well as disaster preparedness and rapid response. He is a humanitarian expert with more than 20 years of experience in all types of emergency contexts across the globe. Initially involved in different initiatives, so that I'm going to invite Jordi to the podium to be as a panelist. Thank you, Jordi. Thank you so much, all the panelists, for gracing us today. So, ladies and gentlemen, distinguished guests and esteemed panelists, it is a pleasure to welcome you to this pivotal discussion on the establishment of Public Health Emergency Management Center of Excellence. So the objectives of this panel discussion is to advocate for and support the establishment of this initiative, ensuring that its development aligns seamlessly with the broader vision of the Ethiopian Public Health Institute. The objectives are: one is to advocate, the second is to demonstrate commitment, and the last one is to enhance regional and global collaboration. So this is the objective of this panel. This initiative is a game changer and a transformative initiative. As it has been mentioned earlier, this will heighten the public health emergency management in a higher position. So I'll proceed with the questions, and I'll invite the esteemed panelists to join the discussion, and we look forward to your perspectives, your expertise, and your vision as we work together to shape the future of public health emergency management. So to begin our panel discussion, it is my distinct honor to invite His Excellency Dr. Masai to share his insights. DG Dr. Masai, Ethiopia has a bold and visionary step in enhancing public health emergency management. So what are the driving factors and strategic opportunities which compelled us to champion this initiative at this moment? And how does it reflect Ethiopia's commitment for the health security, regional leadership, and global collaboration?
Thank you very much, the moderator, Dr. Malcolm, and I appreciate esteemed guests and delegates here this important session, starting from these driving factors to establish the Center of Excellence. The ever-changing dynamism of public health emergencies attributable to climate change, emerging and re-emerging public health problems like infectious diseases of public health importance, the population mobility, and many other factors that are attributable to man-made and natural disasters urged us to institutionalize the public health emergency management system. Actually, the country's reform in health sector focusing on one of the pillars of the health policy, as well as the ministries and the country's investment and development plan, strategic plan, is public health emergency management to protect the health and well-being of our community. So we have been undergoing reforms in Ethiopian public health to institutionalize the public health emergency management with all its pillars, from preparedness to response, including surveillance. We have been advancing our surveillance system because surveillance is the backbone for the public health emergency management to early detect and respond to public health emergencies. So preparedness is also very important. So we have been investing in preparedness in terms of health workforce development, mobilizing resources, and doing the vulnerability and risk assessment, as well as emergency preparedness and response plan, which are tailored to subnational platforms, areas, particularly in the regions, in the districts, and sometimes in hard-to-reach areas. So this is the ever-changing ecosystem of public health emergencies urged us to establish Center of Excellence and institutionalize this public health emergency management here at Ethiopia. That there is the opportunities. We have a long experience of managing public health emergencies and public health leadership. As you know, the Ethiopian Public Health Institute is a century institute and serving Ethiopian people without interruptions by ensuring and providing these essential public health function services, including public health emergency management activities. So this is one of the opportunity for Ethiopian Public Health Institute to establish the Center of Excellence, not only here nationally, this is beyond, to support our neighboring brothers and sisters, particularly the countries in Horn Africa. As you know, we have a porous border, so that is opportunity to really collaborate and establish and institutionalize the system. The other is our geographic opportunity or location. We are the hub and center for Africa Union and Africa CDC. We also have the largest airline, the Ethiopian Airlines, which connects Africa and the entire world. So it is an opportunity, as well as it also alarms us to prepare ourselves for any public health emergencies which can easily be happen or occur in Ethiopia because of the transportation of goods and services as well as people. So this is the opportunity. Actually, I will be focusing on the opportunities as opportunity. That there is, we have also long-standing collaboration and coordination with our African brothers and sisters, particularly neighboring countries, and responding to public health emergencies, especially the cross-border public health emergencies and disease outbreaks. These are the opportunities. And regarding the Ethiopian commitment, actually the commitment started from the legal framework, the reform of institutions in Ethiopia focused on reforming this, the public health emergency management, as well as all the functions of Ethiopian Public Health Institute, giving huge mandates like the PHEM, the public health research, the laboratory system. Laboratory, as you know, is a backbone for health systems, for surveillance, as well as for many other health provisions. So in order to early detect and respond to public health emergencies, the laboratory system is also vital for us, and a lot of investments have been made in laboratory capacity building and decentralizing and improving the access to and expansion of laboratory services in the country, particularly focusing on ensuring health security and disease prevention and control. The other, the mandate, which the government's commitment, that is the mandate given to the Ethiopian Public Health Institute, is the institute is the Center for National Data Management and Analytics to inform policy and generating scientific evidence to inform public health policy and devising strategies which are mostly tailored. And the other is the institute is the secretariat for the One Health, National One Health platform, as well as focal point for international health regulation. This is a big responsibility that is granted by the Council of Ministers for the Institute. So the ministry's commitment is also huge in terms of this regard. So these are the opportunities. I already mentioned the driving factors and forces, as well as the government's commitment, which starts from the legal framework to the investment in public health emergency management and essential public health functions in all aspects of public health functions. Thank you.
Thank you so much, DG. He has emphasized on most of the issues. Thank you so much. you raised about the issue of preparedness rather than acting on reactive manner. We have to be proactively ready for the next emergency and institutionalizing it. Thank you so much. I'll be to the Dr. Kalowa. WHO has long supported Ethiopia's health security journey. So what is the commitment from World Health Organization to have this public health emergency management excellence center initiative? And also, what line with IHR and other issues? How do you explain the presence of and having this kind of initiatives in the country? And also, what are the values that WHO is potentially see while designating this center as a collaborating center?
Thank you. Thank you very much, moderator. Excellencies, distinguished colleagues. It's really an honor to participate in this launch, also in this panel discussion. But first of all, let me extend my thanks and commendation to the Minister of Health and EPHI for this bold move they've taken and for the leadership in this important area of public health emergency management, not only looking at Ethiopia as a country, but also availing the expertise, the experience, and the capacities to other countries within the African continent. WHO has had a long-standing partnership with EPHI when it comes to public health emergency management in responding to the various public health emergencies that the country has been facing over the years, whether they be from infectious diseases or whether be climate-induced, whether be from other humanitarian issues. The public health, the EPHI has been at the center of that response. And that has built the necessary experience over the years that the EPHI has, putting them in a unique position, therefore, to have those capacities that can also be leveraged by other countries in the region. Beyond that, they have also been involved in a number of initiatives which are regional or global in nature. They have been participating in the Global Public Health Emergency Simulation Exercise, which they have hosted, in the Emergency Medical Teams training, AVOC SAGE training, and also in the strengthening of public health emergency operation centers in other countries. So the experience is there, both local and regional, which can be harnessed further to support overall response to public health emergencies, preparedness, readiness, and response. The laboratory capacities have also helped in terms of early diagnosis and identification of public health threats. So that is the background on which puts the EPHI in a privileged situation when it comes to being the Center of Excellence for Public Health Emergency Management. But also quite important is that this initiative is well aligned with the various global strategies when it comes to public health emergencies. The global WHO public health emergency security agenda, the International Health Regulation 2005, and also the Health Emergency Preparedness, Response, and Resilient frameworks. So all these frameworks are quite aligned with the idea of having a center of excellence that will be at the center of building core capacities that are needed, both nationally, as well as contributing to the regional core capacities for responding to public health emergencies. So that puts the institute in a unique position, and also builds on the various collaboration we have had, and aligns with the various instruments that we have had. But in this journey of getting the EPHI to fully contribute as a center of excellence, we have worked together already with WHO to do the necessary assessments, to look at what the strategic planning, to come up with the plan for the 3 years that was being mentioned earlier on, and what are the gaps that have to be filled, and the need for continuous improvement and capacity building of the center itself to fully execute the duties of a center of excellence that serves beyond even the borders of Ethiopia. And within that process, we're also aligning with supporting the center to attain the WHO collaborating center status in public health emergency management, which will capacitate it further to contribute to preparedness, readiness, and response in Ethiopia, which faces a number of public health emergencies on its own, but also help other countries around. As we all know, that these public health emergencies, most of them, particularly from infectious diseases, they know no borders. We have to build capacity, collaborate, and act collectively for the health security of the continent that we all work for. And the issue is, we have a collective responsibility as different member states to the people that we serve, and also the various partners that we work with in support of public health emergencies. And I would like to appreciate that in this journey that we have had in working together with EPHI, we have worked with a number of partners, most of whom are in this room. So it is that partnership and togetherness and collective action that will make our countries safer when in public health emergencies. We have had good collaboration with DG ECHO, my colleague is here, in supporting all these efforts, FCDO, and many others, too many to mention, but all are recognized, and we appreciate the support that we have had in working together in ensuring public health security. And we'll continue to do that to support the center, to link up the center with various capacities that we do have in various networks. Link up the center with the hubs that we're building, for example, in Nairobi for logistics. Link up the center here with the Public Health Emergency Operations Center networks that already are there. Link up the center with our WHO Academy based in Lyon, so that we can have collaboration, sharing of information, and further link up the center with the WHO Hub for Pandemic Intelligence that's based in Berlin. So we can bring to bear also the various capacities that are out there that we can link up the center to be able to be strengthened from that standpoint. And maybe also quite important is the continued need for us to work together to support efforts of resource mobilization, both locally, to support the program that is there, that has been indicated for the 3 years to come, for in terms of building and capacitating the Center of Excellence. So we'll look at all those aspects, continue to partner, continue to bring together and convene various partners that all together we can work towards meeting these objectives. Knowing that we are living in times of scarce resources, we need to ensure that we collaborate, we avoid duplication, and we synergize the resources that we have to ensure much more impact with limited resources. We have to do that so that we continue to be sure that we are ready and prepared to respond to public health emergencies that will surely continue to be with us. Africa always faces, at any given time, many public health emergencies, and we have to continuously be ready. We know we had COVID, and we know we are likely to get other pandemics going forward. The question is not if, but when that will happen. We have to be ready collectively as Africa, but globally as well, to do better when we are faced with the next pandemic that will surely come. Thank you.
Thank you so much, WR, for raising that this initiative is aligned with WHO's global initiative and also commitment for resource mobilization. And the most critical thing that is raised is they'll make the connection. Okay, connection is highly important. Thank you so much. So I'll be to Dr. Sherry. As World Bank is at the back, and building resilient health systems requires sustainable financing. And one of the things that we got when we have this joint external evaluation and other assessments, the issue there is issue of the sustainable financing. And the strategic focus of the COE, one of the strategic focus is sustainable financing in public health emergency management. So how is World Bank? The World Bank's vision and strategic commitment for investing in this public health emergency management?
Now, firstly, thank you so much. And let me just begin by really saying that it's an honor to be on this panel with Dr. Mesai, Dr. Kalua, and my friend Jordi here. Really huge thanks to all the partners here for all the support in general to the health system in Ethiopia. We are living in difficult times. I was just chatting with my good friend Robin here on the challenges countries in Africa are facing with the global developments, right? We are facing a lot of challenges, macroeconomic challenges. Countries are in debt distress, there is inflation, there is fiscal pressure, which of course affects every part of the health system. Additionally, we are all aware of the global developments which will lead to massive reductions in development assistance for health. So, understanding this, I think it's really important to focus on self-reliance, to focus on innovations, and to focus on efficiency. And while doing this, when we speak about self-reliance, the most important thing in my view is to strengthen country institutions. And I think this initiative is really another step in this direction. EPHI has a long legacy of being a pioneer in public health, not only in the country but across the continent. And Ethiopia has been a role model. I was here 20 years ago in Mekelle working on the community health workers. So, and it has been a pioneer in establishing in improving health outcomes at low cost. So this is another milestone, I think, in terms of really strengthening Ethiopia's leadership in public health emergency management. And this very much aligns with the World Bank's vision of creating shock-responsive, inclusive and resilient health systems. You must have heard about the World Bank's goal of ensuring universal health care for 1.5 billion people by 2030. That is not possible if we don't focus on public health emergency management. It is clear. We have a substantial portfolio in Ethiopia because Ethiopia is a priority country for the World Bank, about $1.6 billion in health, of which roughly 20 to 25% is dedicated to pandemic preparedness, response, public health, and emergency management. Yeah. So this is a substantial amount of resources, and we're really looking forward to working with you to plan and implement these and make sure these resources are put to best use. We're looking at innovative financial mechanisms and also contingency financing instruments, pre-arranged emergency funds, and also risk-sharing solutions in a basket of financial opportunities which are available to Ethiopia and for health, but specifically in public health emergency management. We are also hoping that this initiative and, as the EPHI moves ahead on this very ambitious journey of becoming a center of excellence, we're really hoping that this will serve as a regional model, not only for ensuring resilient health systems, but also showing how public health emergency management can be financially sustainable, right? So this is really important, and we're looking forward to working with Dr. Mesai and team and with our partners here on ensuring how our resources can really help in this. Finally, I think, because when I was reading about the event, I was reading this issue that we need to do advocacy, Dr. Malcolm, as you were saying. And I think it is really fundamental to spread the message that health security equals to economic security, right? Ethiopia wants to be a vibrant country with high economic growth, really looking at a job-rich economy. This is not possible without focusing on health security. We know that if we don't invest in health security, there can be long-term effects on development goals of any country. And we have seen it from the past COVID-19 experience, right? So it's really important that we look at preparedness, health security, not as a cost, but as a strategic investment. So this is fundamental. And I like to end again by, it's a job of all of us to make sure that health security is absolutely vital for economic security. Once this message is through, then we can ensure sustainable financing for health systems. I'll stop there. Thank you.
Thank you so much, Dr. Shireen. You raised very critical issues. The solutions of this, the global financing ecosystem change that needs a solution, and the commitment from the World Bank that we have seen, and the sustainable issues. But the most important narrative that we need to work on this, the table has to be changed. Health security is equivalent to economic security. This table has to be shifted. There was one initiative by WHO with the establishment of this Council of Economics for Health, which is planning to make these health agendas to be at the front. Thank you so much. And the other thing is this preparedness is not a cost; it is an investment. Thank you so much. So I'll go for Jordi. ECHO is at the back of the initiatives that we had, and including this initiative. Thank you so much for that. And ECHO has been instrumental in supporting emergency responses in Ethiopia and across Africa. So how can humanitarian and development financing be better aligned to support this Center of Excellence initiative, and particularly in line with the humanitarian development peace nexus?
Thank you very much. First, I want to thank all the audience, all excellencies and colleagues. It's a real pleasure for me to represent ECHO, but broadly the EU, because on talking about Nexus is a game that in the institution that I work with, it's different services are there, and beyond the Commission services, the EU member states. And we are working on making it happen, that it's not obvious. And honestly, in the EU, we see this initiative, this Center of Excellence, under the health sector lens, as an opportunity. as an opportunity to really, the center can play a role of being an umbrella where many stakeholders, are engaging with. No? We don't consider it like a PHEM body. We see like in a space where we can have engage collectively, have an open dialogue, and engage each other. No? Because we understand that we were discussing before in the coffee break that yes, we look for the change of paradigm of shifting from being reactive to proactive. However, there is a coexistence of all the approaches at the same time, meaning that unfortunately the humanitarians, we have our reason to be and to remain, because the magnitude recurrence of crises that affect us also under the public health lens is huge. And this country, unfortunately, is not an exception. No? Which means that we need this strategic and intentional alignment. We don't have alternative. And this shouldn't be only because now we lack resources. It should be a mandate of all of us, collectively. It's not because now funding is shrinking that we start talking to each other to optimize cost. It should be a mandate for all of us. In the EU, we're trying to do our homework. I mean, all the agencies and organisms represented here, we all have our internal kitchen, not without facing challenges. But we are moving forward, and actually I'm proud to say that we have developed a Nexus collaborative framework between the different EU services present in country with the EU member states present in country, which we are translating into more concrete operational Nexus plans. We have started in Somali region, engaging with the regional government from Somali region state. And not as a siloed EU thing. It is embedded into broader initiatives like the one, for instance, I see my OCHA colleagues here, promoted by the UN Resident Coordinator Office, no? A broader Nexus agenda that is being developed in the country, which my colleagues at the EU delegation are even financially supporting. No? So it's very important that we complement each other, to ensure life-saving emergency response for sure, but then linking with anticipatory action, with disaster preparedness, as well as system strengthening. These are key pillars on our programming that we try to intentionally align. No? Then we see, as I said, as an opportunity this center, but it's essential that we enhance building mutual trust. No? Often humanitarians, we are a bit siloed on that. And we see that the center can give us a platform to really have open, transparent, and enhancing partnerships, but putting on the table controversial issues like what happens when we have conflict, for instance. This creates massive disruption on the health system, preventing access to people in need. We should have the space to openly discuss issues that often are politically sensitive. We all know about it, but we should have this open and frank and transparent discussion on the interest of accessing people facing health and other humanitarian needs. No? From the EU perspective, I mean, we don't consider this center and our funding instruments are following that line as a country-specific things. As some of my colleagues have already mentioned, what we are launching today is closely linked with initiatives happening in other countries, and Ethiopia is giving an example on the regional perspective and beyond, and we are really supportive to that approach. And our funding instruments are trying to go into that direction. For instance, promoting innovation, really going towards digitalization. It's nice to see already exercise like the one that has been described on the global simulation exercises. We invest on supporting virtual community of practices that are very useful, and then supporting the workforce development or cross-country or cross-regional learning. No? It's very important that we are able to capitalize on all these experiences, being Ethiopia a flagship country and being a reference, a regional reference as it is, hosting the African Union and the CDC. No? So I will stop here and thank you very much for the opportunity. Thank you.
Thank you so much. Thank you so much, Nordi, for the commitment and raising different issues. Considering this an umbrella, as you mentioned, this is going to be a platform, as you mentioned. And there are a number of areas, this coexistence of responding for emergencies and humanitarian crises. And also having this framework is one of the things that we need. Thank you so much for the commitment, and the points are well noted. So I'll be back to Dr. Sherin. About it is mentioned that the global financing landscape is changing, and there are so many issues coming. So how does the World Bank envision to leverage its support to promote sustainable health security and resilience through this PHEM Center of Excellence?
Thank you. And yes, a very interesting question there, considering where we are today. So I think the World Bank here is working closely with the Ministry of Health on various issues, right? On health workforce training, surveillance, laboratory capacity, and also really supporting the rapid response infrastructure. And we have a couple of projects which really can be leveraged. I was speaking with Dr. Mesai at the break as well on looking at some of the data, how we can really leverage some of the existing financing to improve available data, including the DHS, as we were just discussing. So there are a lot of opportunities, but let me name a few. We have a project called, which is really an aftermath of the COVID-19 response. And in that, we are supporting a national drug vaccine quality laboratory. It's going to be a state-of-the-art center, which I believe the minister and the prime minister want to see as a regional reference center. So that is something we are supporting. We have the Health Emergency Pandemic Preparedness and Response Project, which is a regional project, which is focusing on the capacity building of ARI, for vaccine research and drug development. It's, I think, has training for about 1,000 epidemiologists and regional and district level people to ensure emergency response capacity. We also have the project which works closely with Africa CDC, which is focusing on laboratory capacity. I think there's one BSL-3 laboratory which is being set up, 13 BSL-2 laboratories new, which are going to be set up in Ethiopia. 27 other laboratories are going to be supported for improving their capacity. So really it spans a lot of this work in terms of project financing, but importantly also in the policy space. So, we are supporting the macroeconomic reforms, some of the most historic and boldest reforms led by Ethiopia in the country, which has made a dramatic shift which is really supporting macroeconomic stability in Ethiopia. And part of this, we are supporting, of course, the scale up of the community-based health insurance, and importantly, supporting local pharma. If you look at some of the latest figures, only about, and I don't know if this has changed, but the last figures were that only 4% of the drugs consumed in Ethiopia are locally manufactured, out of the total drugs. And I'm not talking only of the public sector. I'm talking of the public and the private sector, right? So there is a long way to go in ensuring pharmaceutical security as well. And we know during COVID-19 there were challenges in ensuring availability and access to drugs, especially those drugs on which there was import dependence. So we really have to flip this and really enhance local pharmaceutical manufacturing. And there is a lot of reforms the World Bank is supporting very closely with the Ministry of Health, with EFDA, with EPSS, and with EPHI. So we're really looking forward to see how this can really move forward. We are closely aligned with the African Union's new public health order, the IHR, and really ensuring that everything we do here is aligned with regional priorities. Lastly, we do want to see that health emergency management is part of long-term development programming in Ethiopia. And this is something we are supporting through our work in public financial management, in really ensuring that systems are built so that we can have effective public health emergency management. Colleagues, when I see the title and when I see the framing of this event, my colleagues always use this Ethiopian term, Igar Masgabya. I'm sure most of you know what it is, right? So this is really an event. Igar Masgabya, for my friends who don't know, it's akin to putting your foot through an open door and entering into an opportunity. So this is the opportunity. This is the opportunity to sustainable health financing. This is the opportunity to leverage World Bank financing, but also to bring together partners, as Jordi was saying. So this is really the opportunity we have to take, and I really congratulate the Ministry of Health, EPHI, and all partners involved. And let's truly make this an opportunity by working together. Thank you.
Thank you so much, Dr. Sherin, for mentioning World Bank's investment, World Bank's developmental investment in preparing for the next pandemic. And also the critical point you raised is this public health emergency management. The emergency financing has to be part of the long-term development programming. That really matters. Thank you so much for the things, for the commitment you made. So as to the last, to get, before moving to a question and answer session from the podium, I will ask Dr. Masai, what are the call to action things that we expect from different partners, from different stakeholders to make this bold initiative to be realized and to be on the ground. Thank you, Zadiji.
Thank you very much. Regarding the multi-sectoral collaboration, coordination, and partnership, the most recent public health emergency of international concern, the COVID-19 pandemic, has shown us the whole of government and whole of society approach is effective. So we call upon the development partners for collaboration, for financing, for technical and holistic and comprehensive approaches in realizing such kind of initiatives. That there is a government sector, all the ministries in the government. As I mentioned, the COVID-19 pandemic affected the social, economic, and political architecture or ecosystem of the world population. We learned a lot from the COVID-19 pandemic, and we learned a lot, and a lot of lessons learned, that collaboration, coordination, and multi-sectoral coordination is important. So the private sector is very important in this collaboration because of the private-public partnership helps a lot in financing, in innovation, as well as in logistic management and logistic and supply management. So the collaboration and coordination with the private sector is very important. There is WHO as global health security or global public health agency. The technical and financial support and strategic partnership and leadership of WHO, particularly in coordinating member states and enhancing public health emergency management initiatives is very important. And lastly, the academic and research institutes are very important in generating evidence, innovation, and supporting the technical and scientific intervention designing, which are tailored to specific context and problems. So the whole of society and all of the whole of government collaboration, coordination approaches are very important, and I call upon all stakeholders for comprehensive as well as tailored interventions and support, collaboration, coordination and partnership. Lastly, we are here to collaborate to sustain these innovative approaches which ensure and helps protecting the health and the security of our people. So it's good to build a future where our countries are prepared in all aspects, particularly for public health emergencies, and our health systems to be resilient by maintaining essential health services in case of public health emergencies and protecting our people or communities from public health emergencies, regardless of locations or geography. Thank you very much.
Thank you so much, Dr. Masai, for the call to action. Thank you so much. So it is time now for question and answer from. So I'll give you the chance to question, to raise a question for the panelists. No question? I know that lunchtime is approaching. And I think it is ready. But we'll be very happy to hear your questions. The panelists are ready to answer for your questions. I'm just facilitating. I think there is no question. I didn't see any hands. Okay. Dr. Awakawan, and yes, 1 and 2.
Thank you. I'll break the silence. My name's Robin Gorner and I'm from FCDO, from the UK government. Congratulations to everyone involved in this. It's a remarkable achievement and it speaks well to Ethiopia's leadership in this area. I really enjoyed this panel discussion and the range of points raised. Sharon, you spoke about self-reliance and you mentioned that we'd been discussing the changing health financing environment, and we know how strong Ethiopia has been and will continue to be. DG, you spoke about the private sector being very important, and we're aware of the importance that the Ethiopian government places on local manufacturing and the Africa CDC places on regional manufacturing. We're also aware of the very important role that Ethiopia played in delivering the pandemic accord at the World Health Assembly pre-meetings. And I wondered if there's any thinking for you with the new Centre of Excellence around how those two issues come together and how the government's commitment to local manufacturing as well as to such strong public health leadership might support each other. But thank you again.
Thank you so much. I'm really delighted to be part of this commemoration of Center of Excellence for the Public Health Emergency Management in Ethiopia. My question is, given the current landscape, funding landscape globally, what really concrete recommendations do you suggest, especially for the for the domestic financing and other, the public health, the private health sector, the public-private partnership. Really, funding is really a challenge, and we're really currently in an era where, countries are struggling, and how do we really make sure that what we have talked today will be realized in action? Thank you.
Yes, thank you so much, Dr. Awuga.
Yeah, thank you. My question also goes to World Bank, because you mentioned the critical issues on self-reliance, innovation, and the efficiency. I think for me, I would go on more on the efficiencies. Because when you look at here where we are at central level, how do we ensure the support trickle down to where most of actions are supposed to happen? I'm looking at the Kabiri and the Woreda level and at regional level, because looking at what is being allocated and what is it supporting. Because you may have a bulk allocation at central level, but how do we ensure that goes down there and is more focusing on addressing some of those issues which we are seeing are happening? Because without a lot of support at that lower level, whatever we are trying our best, it will not be able to see changes. We need to see communities more effectively engaged. And I think the other point which is important when we look at self-reliance, I saw a lot of community-based initiatives, but I don't know how World Bank and also the government can capitalize into that, because we needed to see how communities are becoming resilient and becoming more aware of what they have. Actually, if they make it more efficient, it can make a big difference. Thank you.
Thank you so much. We can take one. Okay. There's one or two. Okay, three. So let's make it brief.
Okay, thank you. So I think my question starts from your presentation, Dr. Malkamo. Just maybe starting from the budget. If I'm sure, I think I've seen like the total budget required will be around 78 million USD or something. It's just to know like how much of the budget is secured, how much do we have a commitment, or how much is also going to come from the government, and especially looking at the current changing global funding landscape. So how do we see the mobilization of this resource to realize the implementation of this Center of Excellence? And the other one, I mean, it also goes to EPHI and WHO. So when we say Center of Excellence, we're making a Center of Excellence to who? To Ethiopia, to the Africa region as whole, or is it for East Africa, and how we realize also its realization? I'm sure there will be also other initiatives, maybe somewhere also saying Center of Excellence, so how we make sure it's aligned at the regional level. And the other thing is related to community PHEM. Maybe I think if we again go through health extension workers, which are quite busy even with the existing programs, I think almost all the health programs we are targeting to go through them, considering the capacity, the number, and other things. Will it be, will not be another burden to the health extension workers? And what do we see as well as the whole community, rather like shifting away from the traditional like community health initiative? Always we go through health extension worker, reaching the community maybe through different structures, engaging those structures. Also this maybe affected communities or CSOs might have an area or a room to play in this regard. So when we say community, are we expanding it, or are we going through the extension workers? Thank you.
Thank you. Really, I appreciate being part of this important commemoration. Really, it is very important and milestone for our country. Having said that, I do have some concerns that has to be addressed throughout our region and throughout our country. One issue that has to be addressed is we do have a long porous border with at least 3 neighboring countries. When I specify from where I come from, the Somali region, we do have that porous border going from Dawanle to Moyale is about 3,000 kilometers. And the lifestyle of our community as a country is different. So we have to have a strategy which is adaptable to that long porous border. Currently, the official points of entry in our region, for example, are 3. But we do have so many points of interest. And that has to be addressed also. That is one. In our experience at the time of COVID, it was a cumbersome indeed. People are going from here to there, coming from there to Ethiopia, and it requires for you to deal with that. So number one of my concern is that one. The other one is we do have a different lifestyle, livelihood. Livelihood is very different even in our country. So we do have pastoralist lifestyle in some regions. We do have agrarian, we do have agro-pastoralist lifestyle. So our center of excellence in this case should be adaptable to those lifestyles and community-centered livelihoods. So that's my second concern also. For example, engaging health extension workers in very hard to reach areas requires, for example, transportation logistics. And in our case, motorbike or vehicles may not reach even in some areas. So we have to bear in mind those issues and others for our strategy to be successful. Otherwise, I really appreciate the initiative, and I will be part of it for its success and everything. Thank you.
Okay, thank you for just giving the opportunity, and I'm very happy to be part of this program and this initiative. And I say congratulations to all the team and the partner which attend the meeting. So my concern is what I want to raise is the concern I have on the budget and the finance that we face in attaining, tackling the outbreak majorly in the world and especially in our country. You know, my first question goes to the World Bank. World Bank state, Dr. Ashi state majorly self-reliance. But now we are facing major macroeconomic reform in our country. Based from that, a lot of inflation are happening in our country, which result in different kind of maybe one way or other way it may be related with outbreak and different kind of life cost, which resulted in malnutrition as well as maybe related or not directly or indirectly. So what mechanism or what input do you have for containing this issue? And the other part is WHO is supporting differently and directly, indirectly in different region and country. But now WHO are resulting in 50% of reduction in the staff in our country. So is there any way to contain or the impact of this reduction and resulting in budget deficit as well? So the other area that I want to ask is how we will contain the multiple outbreak and conflict in the world. Are the partner ready to contain and mobilize the resource for these different challenges? Thank you.
Thank you. I think the public health emergency excellent initiative is a good idea, and I have some pointers, especially considering the COVID pandemics and last year's malaria, the activation of incident management system. This is a golden idea. I think we can support. So my question one is, do you consider the multi-sectoral engagement guideline? During COVID, one of our strengths and our weaknesses is multi-sectoral engagement. Is there any source of concept of operation guideline in order to, manage multi-sectoral activities like during cholera outbreak or COVID outbreak? And the other, one of the key components is capacity building for implementing on the mission. From the 5 points in the mission, capacity building is key. Rather than giving training after graduation, is there any means to train field epidemiologists during the period in the university, in the 8 universities? Like incident management as a subject, for example, because prevention matters, preparedness matters in a lot of outbreaks. So is there any idea to train university students during the residentship program? And I think considering best practice is very important. For example, in Ethiopia, the universities are used for health workforce during the pandemics and for detecting the disease also. Almost all universities are participated. And the best thing is, the institutional memory is very important. So the importance of after action review may be raised here. So this concept should be included in the concept. So the question all is to EPHI. Dr. Masai.
Thank you so much. Thank you so much all the questions. So most of the things are started from financing. So let's start from Dr. Sherin.
Thank you. Thank you. Thank you for those excellent questions, first of all, because the questions reflect how deeply invested you are in the subject. So thank you so much. So, let me go in the order of the questions which were asked, right? So maybe beginning with local manufacturing, and I think this came from Robin as well, and a few other colleagues. So on local manufacturing, if you really look at the landscape, and I've had a series of meetings with experts in this area, with the local pharmaceutical manufacturers association. We're also engaging with them, with customs, Ministry of Finance. There are a lot of challenges local manufacturers face, which are slowly being addressed. The FX issue has been addressed to a great extent, right, with the reforms. It's still a work in progress, but it has been addressed to a great extent. They still face challenges in accessing credit, what we call as pre-financing. So that is a challenge. So we have to see how to get local manufacturers timely access to credit. Supply and logistics is a huge issue. And so we are working with various partners to see how we can ease that. And this, of course, is not only for pharmaceutical manufacturers, but a lot of other local manufacturers as well. What we're doing immediately is really working with Dr. Abdo in EPSS and others on the procurement arrangements, right? Seeing what reforms can be done in that. The other thing we are trying to address is trying to get importers along with manufacturers the ability to import APIs. Yeah? And then we are also working with the customs to see how to streamline some of the customs requirements for importers and manufacturers. So these are a lot of things which are going into, even as we speak, there's a lot of discussions happening on how to improve local pharmaceutical manufacturing. We have very ambitious targets. I believe that the Prime Minister himself has said that the pharmaceutical sector should be one of the key growth areas for Ethiopia. So we're really working on this to see how this can be a substantive area. Very quickly, one of my colleagues there asked on the concrete recommendations, right, on what we're doing. And I think one of the quick early challenges we are facing is the challenge in commodities. Because of the current issues, there is going to be a commodity gap. And it is worrying, right? Without commodities, you can't deliver services. So we're working with all partners, a lot of partners under the leadership of the Ministry of Health and the Ministry of Finance to see how we can develop a compact by which, donors along with the World Bank and other partners, including, I can't name all of them, but the Gates Foundation, a lot of other partners are coming together on this to see how we can use our donor financing to leverage domestic financing to ensure that this commodity crisis can be addressed. It is still a work in progress, but this is one of the concrete ideas. Besides this, we have to work on innovation, increasingly using digital solutions for expanding healthcare, especially in those areas which are far away. One of my friends was talking about the immense workload on the community health extension workers. How can we ease that by really using tools, but also getting extra support for them? And I completely agree, they are overloaded and overworked in many instances. So these are some of the concrete ideas. We're also looking at efficiency through the PFM approach, trying to see how we can streamline some of the expenditures and where savings can be made. There's also this ongoing discussion on sin taxes, but I won't go into that in detail for now, but that's also on the agenda for the future. So a lot of things are happening. On Daniel's question on trickle down and really strengthening community mechanisms, we have another project called the Human Capital Project, the Human Capital Operation, which focuses at the Woreda, which focuses on governance mechanisms at the Woreda and the Kebele level, looking at the councils, how the Woreda Council can increasingly prioritize health within the block grants and see how expenditures can be really effectively targeted towards the health outcomes, which are decided by them locally, planned by the council locally. And this is something we really would like to invite all partners to contribute in, to really strengthen local self-governance by allowing the Woredas to choose and decide on their health destiny. So this is really important. So that's some of the examples being undertaken, along with all the various measures. On the issue of the training of field epidemiologists, I think the colleague on the first table asked that question on the field epidemiologist, and that's a brilliant idea. And I look forward. We have some financing. I think we have financing for training 1,000 field epidemiologists in the country, but I don't know. I think that is in service, I guess. But Dr. Mesai can probably speak on that. But this idea of pre-service training is a fantastic idea, and that's something we should explore. And I commit to take that forward with our team. But that's a good solution. On outbreaks, yes, we have to continuously improve our surveillance, see how digital tools can be used for the surveillance, and really try to focus on ensuring local institutional capacity. And that is the only way forward. right? Without that, we really can't have a long-term solution. I think one of our friends asked this difficult question on conflict. So that is a challenge, and I think Jordi also raised this when he spoke. We are seeing that a lot of gains we've achieved, not only in health, in education, social protection, a lot of other issues, agriculture. Some of these gains are challenged because of the local conflicts. And that is something we have to see, hence the focus on health system resilience and seeing how we can adapt and really ensure service delivery, even in these difficult circumstances. Of course, the solutions for all conflicts rest with with the people in these countries. And I really hope that we can firstly not only improve coordination between development and humanitarian actors, and using a famous Star Wars line, as I always say, may the nexus be with you. So it's important to focus on the nexus between humanitarian and development and ensure that systems get increase their capacity to adapt and really be resilient. I hope I've covered a lot of the questions, and thank you for giving me this opportunity.
Thank you, Jordi. Some pointers.
No, just on the conflict side, no? Because it's the one touches me more directly. I think that to know how to react, we need to know what's happening, because we lack it. We don't know what's happening. Sometimes after in Tigray and other regions, we have conducted these ERAMS exercises, which are extremely useful to inform recovery and reconstruction, but these are, temporary snapshots of the situation while we still have ongoing conflict with armed groups or armed stakeholders occupying or attacking health facilities, and we don't know the scope in order to inform prioritization or to come with collective advocacy strategies on these hotspots. No? And this is something that I'm proud to say that our colleagues from WHO are looking at, to establish in the country a monitoring system, but this requires government endorsement as well, and acceptance that openly say what's the situation in the country, regardless who are the stakeholders involved. No? And this is a critical point, because it's a starting point, yes, for emergencies, but it influences precisely all the other gains under the development perspective or the future plans. Without having this picture on what's going on, we are completely blind for decision making and prioritization.
Dr. Kal, do you have points to add?
Thank you very much. I think from the questions, it indicates very clearly that people have been very attentive and committed to the discussions. It took a while before people responded, but when they did, I was surprised that I had to fill several pages with the questions. No, thanks very much. I think most of the issues raised, in my view, are suggestions of how, as we build the Center of Excellence, what issues should we take into account? So I hope that this will go into the finalization of the Center of Excellence, etc., to inform it better. So let me go to some of the specific issues that I can respond to. There was a question whether the Center of Excellence is for a sub-region, or is for the whole Africa, or is for whatever. I think this is a resource which is available and should be available to any country that needs it. I think we should not restrict it per se to say, oh, this is just for East Africa. As long as there's a need anywhere in the continent and there is a source or a resource that can support it, I think we should encourage that happens. Having said that, I think when we go to the process, I said we are in the process of trying to get EPHI as part of a collaborating center of WHO. In that process, then we will define exactly what are the specific areas within the public health emergency management, what are the specific areas for which it will be a collaborating center. So I think we'll get to that as we elaborate the issue of collaborating center. But a center of excellence with so much experience, with so much capacity, I think it should be available to support wherever the need may arise. There was also another issue that I wanted to go into specific before I say a few general things, was the question of, I think it's linked to the fact that we don't have resources. That affects everybody, including WHO, and I think the point was about our reduction in staff, which is going to be there. I think this is the time when we should begin to really prioritize, work together and ensure synergies and avoid duplication. I think it will be very important as we go forward to do that exercise so that with fewer resources we can go a bigger distance. And I think that will apply across the board for everyone else. And we should also look at all other issues that would help us. I think we learned a lot in COVID, for example, that self-reliance in a number of issues, particular, as my colleague said, pharmaceutical security, is a key issue. And processes began, even during COVID, for local manufacturing, and WHO, Africa CDC, we are supporting all those kind of processes. And we need to continue to do that, I think, to deal with some of the challenges that we have. There was an issue about long porous borders. Yes, that's the experience, and we know this is how various public health emergencies or disease outbreaks would spread. And this should be part and parcel of the strategy. And it is part and parcel of the strategy to deal with ports of entry and strengthen ports of entry. And also the surveillance associated with that. It means in all our trainings, in our capacity building initiatives, this should become embedded as an important area. So we do recognize that the issue of ports of entry is important. There was the issue of livelihoods. I think any response or aspect of preparedness should take into account the local context, because it varies quite a lot. So as long as we take into account the local context, the kind of livelihoods should inform the strategies that we will have to implement. Meaning, therefore, as we do the training or capacity building through the Center of Excellence or just through exchange of information, we should incorporate some of these issues to ensure that we have a meaningful preparedness and readiness to deal with public health emergencies. I just want to agree very much, and COVID showed us that you cannot have economic security or even development without addressing the public health emergency issues in general. And with COVID, everything stops. Everything stopped. So every sector was affected because we have that. So it's a very important aspect to look at in terms of ensuring not only that people are healthy from the disease perspective, but the every other aspect of livelihood for an individual, or social well-being is covered. It's absolutely important that we do address this. And within the space of health itself, we cannot achieve universal health coverage with essential services if we don't deal with the issue of public health emergencies. And therefore, we have to address this comprehensively. And we also need to have health systems that also responds, allows us to be able to deliver universal health coverage while addressing public health emergencies. In many cases, our health systems are such that they get so easily overwhelmed with public health emergencies that the other services begin to suffer. So the question of nexus is important, that we have to address that nexus. The development and the humanitarian wings of any work we do should work together. Because if you can prevent diseases, you also or any humanitarian crisis happening, if you can prevent, you minimize the cost associated with the response, because the response is always very much more expensive. So at the moment, there are opportunities through the pandemic fund, etc., which we should leverage and take advantage of to try to begin to strengthen aspects of preparedness. Let me see what else is there. Maybe let me stop at this at this point, but just to say that we are in a time that we can't do business as usual. We have to be innovative. We have to make sure that our resources go further, and also we have to strengthen the issue of domestic resource allocation and mobilization and use, because I think we will need to do that to survive the crisis in the next few years in terms of resources available. Thank you very much.
Thank you so much, WR. I will invite Dr. Masai to reflect on some of the questions and to have a final say on the panel. Thank you, Dr. Masai.
Thank you very much for questions, reflections on the presentations. One of the question and the comment was on the local manufacturing and the private-public partnership. The Ethiopian government has a clear objective and a strategy for encouraging local manufacturing by making favorable conditions for investors and private sector. So that encouraged particularly this local manufacturing. Actually, in terms of the resource mobilization and the financing, my colleague from World Bank already reflected on that, but this one is one of the priority macroeconomic reform issue from the government side, and clear objectives and the strategies are in place, and the government closely following and working on that to encourage local manufacturing and private sector. The other question is adaptability of the Center of Excellence. Actually, you know, we do not follow one-size-fits-all kind of interventions. We do tailored interventions for our regions or for our subnational strategies and protocols for all regions. Even within regions, there are differences. Within the country, there are differences between regions. So all the programs and the projects, as well as the interventions we devise and implement in different parts of the country, are tailored, and they will work in close collaboration with our regions. So we'll also enhance this collaboration and work together to address those areas which need special attention. This is the general term and the general fraction that I can say. The other is in terms of, it's about the resource. Actually, we are not starting from scratch. We have the existing system. We integrate this with the existing system of public health emergency management. So some of the issues regarding the resource can be addressed by integrating the activities and aligning activities, and of course prioritizing most of them. So the other gaps can be addressed by resource mapping, as well as detailed and robust assessment in collaboration with our development partners. So the details of this resource mobilizations and issues regarding the gaps can be addressed in the coming implementation processes. The third question is regarding the multi-sectoral approach. Actually, we have the existing system which are efficient and working. It was really demonstrated in COVID-19 pandemic. The highest body, for example, the national coordination team or coordination body is Honorable Deputy Prime Minister, so which is the National Disaster Risk Management Council, where the Minister of Health and the Ethiopian Public Health Institute is represented, and all line ministers are represented there. So specific issues can also be entertained and managed by the interministerial collaboration and coordination platforms. So I understand it needs to be strengthened, but the existing system should be proactive, as well as it should be functional as required. It also should be cascaded into the sub-national levels, particularly in regions, where the regional presidents and key sectors, the public sectors are involved. So this platform should be strengthened, but the national coordination body, in case of national emergencies, are very well coordinated and managed. So we'll take this assignment to take our part and work on it with the line ministers and the Minister of Health. The other is pre and in-service training regarding the incident management system. Actually, in service training, in field epidemiology training and other capacity building trainings, the incident management and the public health emergency management pillars are included. But still, we should, if there is gaps, we can identify gaps and assess, as well as come up with remedial solutions. But regarding to pre-service training, we are closely working with the academic institutions, particularly the universities, who train epidemiology and public health professionals. So we'll assess and work with them and identifying gaps in terms of this incident management system, whether it is in syllabus or course contents of the health professionals, and also we'll encourage them to or work together to have like internship programs in collaboration with the Ethiopian Public Health Institute, particularly for areas or disciplines which are has to do with public health and epidemiology tracks. Thank you.
Thank you so much, Dr. Masai, for the commitment and for your leadership. We really appreciate that. Specifically to the community FEM, I'll just give you a notification. This is a new initiative. We are going to have a schedule in the coming future so that we'll debate on that. We know that there are so many initiatives which is on the health extensions, but the problem is not that. As Dr. Sherin mentioned, we didn't make it easy for them. So we'll make it through different ways. One is using simple tools. We have to digitalize. And the second thing is there has to be a shift on the thinking. Our thought has to be changed. There is a thought that all the community activities has to be done by health extension workers. That shouldn't be. The community, the volunteers, and even other health professionals has to be engaged in such kind of activities. So we'll have a session and we'll debate on this issue. This is critical. So we'll have a discussion. So thank you so much, our distinguished panelists and the audiences. There are so many questions raised. The issue of this session is to knock your doors. So your doors are knocked so that you have so many questions inside. So I can say that our objectives are met. So everyone is ready to advocate. Everyone shows the commitment that they are going to make and the commitment they are going to make in practice in the near future for the implementation. And the third one is every partner, everyone in this house is ready to collaborate. These are the three objectives that we have set to be achieved in this panel. So I can say that these are made. So what we have heard today reinforces a powerful message that achieving health security is a shared responsibility. The Center of Excellence is a platform for leadership, innovation, and collaboration. This is just a platform for everyone starting from now to be engaged and to work with us. Let us move forward together with a clear purpose and a strong partnership. Please give us a big applause for the panelists. Thank you so much all for your attention. Thank you so much.
Recording stop.
Now I will invite to the floor His Excellency Dr. Masai Hailu, Director General of the Ethiopian Public Health Institute, to give us a closing remark. Your Excellency, please.
Excellencies, all protocols observed. On behalf of Ethiopian Public Health Institute and myself, I officially declare our today's launching program is closed. Thank you very much for your commitment, reflections, and fruitful discussions and deliberations. I reaffirm you that we work hard with our partners, all partners, including the diplomatic community, the development partners, and government line ministers to realize this one of the best public health initiatives we have started. So I reaffirm our commitment once again. Thank you very much. Have a good time.
used to. Sometimes when my eyes close, there's no one I can turn to. And I know it's not shit the past.
but you really respected that our work in emergency is also part of our continuous effort, and you have also come to be with us in a very critical time. So I just want to say thank you to our regional health bureau heads, all delegates, Dr. On, country director, country representative of WHO, regional health bureau heads, Shireen, our World Bank representatives, all general, everyone, all protocols observed. It is always a privilege to stand before you to speak about something that our country has been always struggling, but also has seen a resilient effort. 100 years of Ethiopian Public Health Institution history, which we will celebrate very soon. One of the oldest primary public health institution in Africa. I don't know in the world. We don't usually say one in the first, that old saying. But most importantly, today we came together for a purpose about public health and public health emergencies. I see Ruben, I see all the team. I missed all of you, so keep my words saying that all protocols observed. We're here to join external evaluation that was conducted by Ministry of Health and WHO to see where are we in our emergency operation care. And most of you knew that during COVID, we have seen how challenging it could be if we're not ready for public health emergencies, and how institutions were ready have showed us that even in higher level countries, or in countries that we would expect the public health emergency response that could be so agile, so fast, can contain things very easily, could be breaking in contexts that we cannot predict. And the world is becoming more unpredictable because pathogens don't have borders, and our borders are always porous when it comes to pathogens. The work we do for public health emergency preparedness and management is mandatory. It is very critical. It's the fabric of who we should be if we're talking about health and health response. Something that we continually strive to be perfect, but even all other countries that still think they were perfect were even struggling. You can imagine us. Years could be long, but strengths are still being tested. We're trying to see what our institution in emergency operation care, even those of you who come from our PHEM centers, all of you who have tirelessly worked every day about checking on emergencies, if they're really at a level that they need to be reported, are we really at an alert level that we have to be very cautious? All these decisions that we make every day makes us a public health emergency institution. And for us, our emergency operation centers are functional. They're helping us understand, but we still didn't meet what we want, and that's why we are all here together, not just to inaugurate about making this a center of excellence, but a center that would function both for Ethiopia, for Africa, and also for the globe. Because global health security will not be worked if we don't have a strong public health institution in a country. And for us, in a big country like Ethiopia, if we don't have a strong public health institution in each region. And when it goes down, data that are coming from the public health, from the primary health care component, from the community, has to be linked to what we see. So it doesn't have to be at a regional level, it has to be from home. We have a strong mechanism that our community understand what is important, what is critical, what is something that is not normal. We have to just accentuate on what are the experiences of our community, our traditional healers, our community's reporting mechanism, working around diseases, and even responding to them. And they know when to contain. We have a lot of things that we can share to the other globe, because even our approach to primary health care is deep-rooted in our community. What was working during COVID is because our community still listens and also still looks at what could be very threatening. And the world has also changed. Of course, information is coming in a stronger version now, that we hear more and more things. Sometimes it helps us to be strong, but sometimes we might be more negligent, thinking that this is something that would go away without doing anything. But a strong center of excellence in primary health care that we are now together in here to inaugurate, in a sense that we will work it together with our partners, our donors, our partners, all stakeholders, because the work that we do in primary health care, but most importantly in emergency public health side, cannot be done just by the health sector. It is a One Health approach that we need to follow. one that we do with Ministry of Agriculture, all other ministries and sectors. So for us, just like what we do in nutrition, just like what we do in the other side, the work we do in primary health care, but most importantly in emergency public health, has to be cross-sectoral. So this will be for us a health system in Ethiopia, in Africa, and the world that will be ready to face complex challenges on the public health front, helping our professionals to be more agile. We know that this is not easy, and you are always at the forefront on fighting and also preventing disease outbreaks, natural disasters. We have our emergency response team that we want, not just for Ethiopia, by the way. We want that type of team for Africa. So we are striving to see that. I would like to take this opportunity to emphasize that building and enabling health system takes everyone. And we are ready to do that together with you, for all who want to work with us and with the government of Ethiopia, because we have a clear plan. We know the solutions. Some different things have been tasted before. But if we work on one plan that we already set forth, we can definitely change the curve that we took from the lessons from COVID-19 pandemic, the number of lessons that we recorded and not recorded, because a lot were not recorded. But particularly highlighting that there is a critical need of efforts to come together, enabling the health system to further develop on the needs of our community, because the community is not looking at us like before. Things have changed. I would like to take this opportunity to congratulate our team, the leadership team at Ethiopian Public Health Institute, the technical arm, even at our ministry, but most importantly, those who are working every day at the forefront, at the community level. Our community health extension programs, our community health workers, our doctors, nurses, physicians, laboratory technicians, pharmacists, everyone who contributed to the cause, even our emergency and ambulance drivers, who are supporting us every day to be at the forefront. And my sincere gratitude also goes to the World Health Organization for their continuous support, because we are navigating in this path together. Because we have a lot that we did in the past 100 years, but there is a lot that we have to be prepared, and particularly in the efforts that Ethiopia gets the capacity to serve and a collaborating center of being recognized. It is only that we work together and we continue that no outbreak becomes a threat to our children. To us first, because our children will come if those who are still pregnant, all the threats that you can imagine. For those who are trying to see the future, we want to ensure that no outbreak goes unaddressed and no emergency cripples our health system. No segment of the community is left unseen, untreated. Let us all push forward, which I believe we'll do. There are always a challenge, but we use them as an opportunity. And we want to be a beacon of hope for everyone. A continent that would show the globe that things can be done, and we can do it from inside. When an egg is broken from outside, it usually doesn't have life. Probably we can eat it, and we can prolong our life. But as an egg is broken from inside, there is usually for a life, another life being created. There is a hope for us if we continue to commit for excellence in the health security and strengthening our resilience in saving lives. And I want to congratulate you, but give you also a big assignment that we need to do a lot. I thank you for all the partners, our Gavi, all the team I see in here, partners who came from all over the world to be with us, and our regional partners, everyone in here. And we always continue together, and because there is hope in humanity, and I trust in all of you. I thank you.
So we'll have one program which is at the last, which is a ribbon cutting about the official launching. I will invite Her Excellency Dr. Mekdes and Dr. Masai to have this program. Thank you so much. Please. And Dr. Yes, please join.
Thank you, Your Excellency, Dr. Mekdes Daba, for officially launching the Center of Excellence and leading us in this symbolic moment of progress. And now we will have a group photo here at the podium. የግሩፕ ፎቶ ይኖረናል። After the group photo, we will invite you all our guests to participate in a walkthrough of the gallery where you will experience the rich history, achievements and future vision of PHEM in Ethiopia. ካሜራማኖች ሬዲ ሁኑ። አንድ ጊዜ ግሩፕ ፎቶ ይኖረናል። ጋለሪ ዎክ ይኖረናል። ከዛ በኋላ የምሳ ፕሮግራም ይኖረናል። አሁን ግን ግሩፕ ፎቶ ነው። አንድ ጊዜ ወደዚህ ተሰብሰቡ እባካችሁን።